Swadika and good afternoon, and welcome back to the English language summary of the COVID-19 situation in Thailand, live from the Center for COVID-19 Situation Administration, or the CCSA. For today's briefing, which is Sunday, the 6th of June, 2021, allow me to start with the latest numbers, the latest statistics for today. We have today new confirmed cases standing at 2,617 cases. In this number, we have 1,095 cases from walk-in patients reported from healthcare facilities. 889 cases are from active case finding, and 604 cases were reported from penitentiaries, and 83 are from national arrivals contained within the state quarantine system. So we have right now the total tally of active cases or patients being treated at medical facilities standing at 49,714. There are within that number 1,209 patients with lung inflammation and 361 patients who are now currently on ventilators. So we also have a good number of new recoveries, standing today at 2,242. This leaves us with a total number of recoveries since the start of the pandemic, standing at 126,517 persons. Today's new number of fatalities is at 23 cases. So this leaves us with an accumulated number of fatalities standing at 1,213. Most of the fatalities occurred in Bangkok. Today, there were 13 cases from Bangkok and 4 fatalities from Samut Prakan. The age range of these fatalities today are between 32 and 79 years of age, and the median age stands at 62 years of age. We have today the number of highest infections by provinces. Bangkok again stands on the top of the list with 675. Samut Prakan is the second. Samut Sakhon is the second, standing at 288 cases. Phetchaburi comes third with 196 cases, and Nonthaburi with 163 cases, Samut Prakan with 124. I'd like now to report to you about the observations and the discussions we had today at the daily CCSA operational meeting this morning, and also a summary of the briefing from Dr. Tui Sin, who just reported to us right now. So today we talked about 83 new imported cases, so cases that were detected in state quarantine system, which is significantly higher than the daily number of imported cases in the past few weeks. And this is partly due to an increasing number of people passing over the border, the land border, illegally via natural crossings. More than half of the new imported cases are from Cambodia. And yesterday, the Border Patrol Police were able to identify 173 illegal crossings. So that brought the total number of people who crossed the border illegally since July of last year, 2020, to more than 34,000 people. The CCSA has therefore instructed the Ministry of Interior to tighten border control, especially in the provinces of Trat and Chanthaburi. which are adjacent to Cambodia. Immigration checkpoint at the Ban Klong Luk border crossings between Thailand and Cambodia, which previously opened for 3 days a week, is now open from Monday to Friday. So this will help facilitate legal entry into the country. Provincial authorities along the border areas have also increased their capacity of local quarantine system to accommodate more people who wish to enter the country through land border. So we hope that this will help contain any potential infections. The Bangkok Metropolitan Administration, or the BMA, has also reported 5 new clusters of infections in these particular districts, the districts of Wattana, Dusit, Ratchathewi, and Lat Prao. And 3 of these infections, clusters of infections, included 3 local communities. These are communities which are quite crowded. They live very close to one another. And also there was a construction camp and a fresh market. Therefore, the Bangkok Metropolitan Administration has ordered the closure of the construction camps and the market, and they are now considering to impose a bubble and seal measure to the said affected areas to prevent further spread of the virus. And more active case findings will be performed in the surrounding areas. In addition, the Department of Disease Control will also conduct risk assessment surveys. In fact, they've already started conducting such surveys for all of the construction camps within Bangkok as appropriate. And this is a proactive and prevention measure. As these areas continue to be points of concern, and they are prone to viral transmissions. And currently they have already conducted 367 surveys in 367 camps, construction camps, out of 409 camps. Moving along, I'd like now to give you some updates on our national vaccination campaign. Yesterday, I mentioned that the Ministry of Public Health and authorities concerned have already communicated with provincial authorities to accommodate the registration for vaccination appointments for foreign nationals. To bring this into perspective, allow me to cite some examples from certain provinces and districts who've already launched their registration platforms for foreigners. These are, for instance, Chiang Mai. I think you'll see this on the screen very soon. Chiang Mai. So Chiang Mai Public Health. Yes. Chiang Mai, Phuket, Hua Hin, and Koh Samui. And these are also provinces where a high number of foreign nationals are residing, and hence their readiness to cooperate and fix up this very vital registration system. So for Chiang Mai, foreigners who reside there in Chiang Mai can register for vaccination appointments via this website from the Chiang Mai Public Health Office. You can also scan this QR code, which is on your screen right now, or just visit the website World Wide Web at .chiangmaihealth.go.th. Also in Nakhon Ratchasima province, they've launched an application called Korat Prompt. This has been developed for vaccination registration for both Thai and foreign nationals. But currently the province is now giving priority to the elderly and those with chronic diseases, so high-risk groups, and the application will soon be available to the general public when more vaccines are distributed to the province. Also, we will show on the screen now for Got Samui. Got Samui COVID Center has launched a Smart Samui website for vaccine registration. This website can be reached by scanning the QR code on your screen or by visiting this website called worldwideweb.vaccine.smartsamui.com. Also, in Hua Hin, in Hua Hin, foreign nationals can register for vaccination at Blueport and Market Village shopping malls. Those who wish to register must bring a valid passport and a photocopy of the ID page of the passport. And also in Phuket, we know very well Phuket is a very good example. The vaccination campaign has already begun, and many foreigners have already registered and also already been vaccinated. The Phuket Public Health Office reported that more than 28,000 foreign residents and workers have been registered through the Phuket Must Win web portal. This website is still open for new registration as the province aims to inoculate more than 70% of its population by the end of this month. So these are just a few of good examples of how the Ministry of Public Health has been coordinating with provincial authorities to guarantee that all people who reside in Thailand will receive their vaccines as early as possible. And we hope that in due course, more provinces will be publicizing their campaigns and registration channels. So we urge our viewers to closely follow the announcements of each provincial health authority or the provincial COVID centers for new updates. I have some very important news as well, as there's been some news media reports on the new clusters of infection detected in ice factories. And these are in Chonburi and Samut Prakan provinces. There's also been information that, of course, with infections in ice factories, this could lead to potentially contaminated ice being distributed in markets. And therefore, the relevant provincial public health officers have confirmed that both factories that have, with the the infections, have been asked to temporarily close and to cease production. And all of their products have been removed from market shelves already. However, the Director General of the Department of Health has informed the public, especially in Chonburi, Samut Prakan and Chhat Cheong Sao provinces, to remain vigilant on the consumption of ice, as the coronavirus could survive in cold packages for up to 3 days. The Director General advised that the public should buy ice from trusted companies, and ice packages should be washed to remove any possible contaminations. So, before I end my briefing, I'd like to give a very warm shout out to many foreign embassies, our friends from the diplomatic community who have reached out to us and expressed their understanding and words of encouragement to our team during this very challenging time. Your help in disseminating vital information from the CCSA to the expat community living in Thailand is very, very much appreciated. We also ask for your patience and understanding as the COVID situation is still fluid in Thailand, and we will need to adjust our plans to increase efficiency and to cope as best as we can. Our intention remains that we will inoculate everyone living on Thai soil. That is the policy, and that is what we are determined to carry out so that we can reduce the risk of loss of lives and move forward to resume our lives as normally as possible and together rebuild our lives from any current economic hardships. The long time we've been living with COVID has taken a toll on everyone, and there is COVID fatigue. And and exasperation and frustration in every society all over the world. I'd like to stress that in such difficult times, there is light at the end of the tunnel as governments accelerate their vaccine drives. It will be only a matter of time before we reach our national vaccination target of 100 million doses within this year, which will help revive much needed normalcy back into our lives. Until then, please stay safe, be vigilant and patient, and practice DMHTT so that we can reach that goal together at the end of the tunnel. So this is all I have for you today. Have a very good weekend. ขอบคุณค่ะ สวัสดีค่ะ